Well, I've had fibromyalgia for 35 years now. And the pain had progressively got worse, and I'd tried the various medicines that are approved for it. There's 3, I think, and none of them did the job, got rid of the pain. So I went over to the pain clinic and eventually put me on morphine, and that's been wonderful. Because if it doesn't get rid of your pain, well, it take a little more. Eventually, it will get rid of your pain.
I think it's important to also recognize that he's on long-term opiate treatment, which is a very relevant issue in medicine today for all practitioners of all kinds. It is considered to be not optimal to have a person with non-cancer pain on chronic opiate treatment.
Opioids are often prescribed to people with depression and anxiety, many times because people feel they have nothing else in their toolkit.
It sounds like you kind of lived with your symptoms.
Well,
and coped.
Well, maybe there is something we haven't touched. I call it the night of the stove. 15 odd years ago, I was going to commit suicide, and lived in an apartment over on Western Ave. And this was not going to be fooling around. This is for real. I put the shower liner over the stove. I'd blown out the pilot lights. I put pills that I've been saving over the years, sleeping and pain relievers, put it in the coffee grinder. And I stood there and I looked at it and I thought, in 15, 20 minutes, it's all going to be gone. Yeah, the pain will be gone, but all I could see is this void.
I think maybe one thing that's not necessarily apparent to a clinician is how incredibly debilitating it is to live with chronic pain. And patients like him, I think, highlight that point. I spoke with one patient a long time ago who said that they watched an interview on TV with a hostage, and they said it spoke to them because they felt like they're almost a literal hostage to their pain. And it's not surprising that so many patients with chronic pain have suicidal ideation.
If you have bad things, that helps you define life and to define what is bad and what is not. And not bad is good. And I'm just enjoying it.